Now, according to data released by the WHO, that was on 14th of February, actually that is this month, did indicate that Kenya is still among the top 5 counties in Africa with highest infections of cholera. That is what you have been reeling with as a country. In fact, as early as this month, you're recording about 72 deaths, slightly above 4,000 Kenyans infected with this disease. Not forgetting about the 17 counties where, cholera has really taken prevalence. That is what you're set to converse with my guest right about now, just to help us understand where we are as a country, the situation in terms of data and statistics, and also what they are doing as a, organization in conjunction with the Ministry of Health to deal with the outbreak of cholera. I am holding court with Khabala, who is the Deputy Medical Coordinator at MSF. Kelly, welcome to the program.
Thank you.
Just before we get to the data and the numbers, that's what we'll be doing in the next 30 minutes. But for the purpose of context and understanding what exactly you're doing in partnership with Ministry of Health, first things first, MSF, what is it? What does it do?
Yeah, MSF is an acronym for Medicine Sans Frontières, which is a French name. But in English, it's translated as Doctors Without Borders. So Doctors Without Borders is an international, independent humanitarian and medical organization that offers support to populations that have been affected by what we may call man-made and natural disasters. For man-made disasters, example would be conflict. That is causing, populations to get displaced, and therefore they get into precarious both humanitarian and medical situation that their needs need to be addressed. In terms of natural, of course, we support also communities that have been hit by the disasters. Yeah. For example, floods or even drought, and of course disease outbreaks like the current cholera situation. Yeah.
So you can basically say, just the name serves its purpose, Doctors Without Borders, quite literally. And this spans across various counties, or there's some specificity as far as that is concerned?
Yeah, it's various counties. Actually, I would say the whole of Kenya. Okay. But also to say that internationally, we are in about 70 countries in the whole globe. But intervening in different thematic areas in terms of healthcare provision. For example, in the country here in Kenya, we are having a non-communicable disease program in the western region. This is Homa Bay County. And in addition to this, we are also supporting MOH, of course in collaboration, to respond to the cholera situation in Homa Bay. We have some cholera cases that are still ongoing there. Yeah. In Nairobi, we are supporting the Eastlands region in terms of offering SGBV care. This is sexual gender-based violence care. In Mathare, we have a center there. But also we have a youth program in Dandora, which we are focusing on youth health needs. For cholera, also we are supporting Mama Lucy, Kibaki Hospital, and Bagathi. Other than Nairobi, we are also in Kiambu, where we are supporting Ministry of Health in conjunction with NASCOP to roll out a key population program, which is specifically meant for people who use drugs, which we call PWD. While in the northeastern region, we are based in Dadaab, a refugee camp, where we are offering primary health care, including secondary health care to the refugee population, including the host community. But also tied to this, also in Mombasa, we have a youth program that is focusing on, youth-friendly services, especially for 10 to 24-year-olds who are excluded in the healthcare system, and more specifically the key population, and also addressing the issues of mental health. And also just to destigmatize, service exclusion for this specific population. But in the whole country, we have a component of emergency response that we scan through the whole country to look at what we've called man-made or natural disasters. So of course we offer emergency support. For example, due to the ongoing drought that has been raging for the last couple of years, we have been involved in offering nutritional programming or nutrition support programs, including water and sanitation in this region. With the just ended Ebola outbreak in Uganda, where Kenya has been on high alert. We've been also involved at the national level together with the Incident Management Committee just to look at EVD, Ebola viral disease guidelines, and how Kenya should be prepared for response in case of an Ebola outbreak. Yeah,
and we almost did have the same. Was it late last year when it was emanating from Uganda? Was it?
Yeah,
so clearly just
November,
November, well said. So clearly just listening to what you are enumerating, there's really quite a lot you're dealing with and you're handling as far as this Doctors Without Borders is concerned. And momentarily we'll look at the training, how this one goes, because looking at the different counties you mentioned, the different diseases, I would want to imagine that really quite intensive training might be going into this before you even deployment. But we'll come to that in a bit. But before then, you've really talked about cholera in your response, as you're talking about basically what you're doing. And just looking at the statistics, we're talking about, is it 16 or 17 counties thereabout? Counties Nairobi, Tana River, Kiambu, where these cases of cholera are being recorded. And in Kenya alone, we have 47 counties. So one would ask, what is so peculiar about the 17 counties that would record high cases of cholera? What is it?
Yeah, no, there's quite a number of confounding reasons. Yeah, of course, one thing you realize that most of the counties now that are having a cholera outbreak, they are kind of restricted to the northeastern region. Quite a number. Of course, we have counties like possibly Homa Bay from the west, but that stands out as an outlier. Of course, Nairobi, because of the reasons that we'll mention shortly.
Yes.
But just to start with the northeastern region, of course, quite a lot of dynamic is happening there. One, we have an influx of new arrivals from the neighboring countries. And this is because of the drought. We've seen the drought situation in Somali. It's increasing in intensity. We've seen in Ethiopia, but more so in Somali. So we have migrants who are getting into the country, and then they are conglomerating in the refugee camps. Therefore, if you have an increased population, but the infrastructure for the amenities is not increased, that's a risk for cholera, because you realize that the quantity of water that was consumed by one household 1 year, 2 years ago, it's shrinking, because now you have an additional population that has to consume the same water. Space is the same, and then of course sanitary amenities. We have an increased ratio for people per number of pit latrines. So you find that now with increased population, people cannot access even the basic sanitary amenities like pit latrines. Of course, with the drought also comes malnutrition. Because if you don't have food variability, if you're not eating a balanced diet, possibly you are consuming one type of food, you already have a negative impact on your immune system. And then the other thing is, even if you had one type of food, but the quantity is not enough, it worsens again that. So you realize that with malnutrition also, in addition to other comorbidities, and then this population is prone to have many other diseases, even not only
Cholera. So right. then what you're saying is that just with what we've been dealing with as a country, the drought cases you've been reporting and recording, this is actually what is skyrocketing to now what we have as a country dealing with issues, the cholera, so to speak, in these specific counties, just because of that.
No, we would say it's part of the reason.
It's part of the reason.
But of course, other things that is driving this, we have also conflict in the region that now is making people to move. When you move because of insecurity situation, possibly where you sleep does not meet the minimum, needs or comforts of a human being, because if you manage to move, you don't move with your house. You probably move with a small, so you'll sleep out in the cold. You're going a place where there's no toilet. Any water you get on the road, as much as is little, is not treated. You feel thirsty, you have to take it.
And you'll take just any water.
So all these are
contributing factors.
But also the other thing from the health perspective, also I think there's a lot of dynamic happening in the just healthcare sector that we also continuously need to improve our surveillance systems.
In what regard?
So that we are able to improve our systems on to detect suspicious cases early, and then our response team as a general healthcare fraternity to move in fast. If you have one case or two cases, sometimes it's easy to contain when you have an alert or an alarm if you respond to it in early time. Otherwise, it spreads to many more.
Thank you.
In Nairobi, to be more specific, you can see also there's an increase of population. There's an obvious rural-urban migration. So there's population increase, and therefore it's causing overstretching use of resources. And this includes, for example, water. That is in Nairobi, so that probably is not adequate in some settings, especially rural resource settings. Also, sanitary amenities, toilets are not enough. Because of increased population, we are also having a leakage of the sewer system, which may be, interacting with the drinkable water.
I hear you. Okay, so then does that mean that the same reasons as to why we are having these high numbers of cholera outbreaks or cases in Nairobi is the same as is in Kiambu in terms of factors and reasons? Because earlier on you had said that when you look at these counties, a good number of them are ailing from the northern part of the country, but here we are talking about Nairobi, Kiambu, Homa Bay. So this influx of people from different parts is largely or partly what is contributing to this?
We would say, there is some correlation. We would say, because of course we know counties like Nairobi, Kiambu, they are quite fluid also in terms of movement, travel, population increase, and this causes overstraining on available, especially drinkable water.
Okay. All right, I hear you. So, Kelly, might you be in a position to tell us where we are as far as this numbers is concerned? Because from what I checked, as early as February, we had recorded about 72 deaths just ailing from this particular outbreak. Looking at some of these interventions, and also we'll touch on them in a short while, but then has this number reduced? Is it the same? Is it increasing? Where are we in terms of data?
Yeah, of course, accumulatively the number are increasing.
It's increasing?
For now, we have towards 5,000. I think by end of last week.
That's what, the number of cases or deaths?
No, cases.
Just reported
cases.
As
cholera cases is about 4,800.
Yes, 892.
We have also a slight increase in deaths, which is 85 cases as per end of last week, with what now we call a case fatality rate of 1.8%, which for cholera that is fairly high, because we should be aiming. This means that if you have cholera, you need to have treatment because it's treatable in good time, so that we avoid some deaths. So, of course, any death rate that is above 1% for cholera, that we consider it quite high. However, of course, through the Ministry of Health and collaboration of other partners, there has been some response in these specific counties, and the cases are coming down, in terms of daily numbers. So we can see a downward trend. But of course, it's too early to celebrate. I think we should continue to mount this response and to stay vigilant. Because as you may know, that cholera is transmitted through fecal-oral, meaning through human waste, and then you ingest the bacteria through either contaminated water or food. We are looking towards having a rain season in the coming 1 month or few weeks. So of course it causes some wash away and contamination of existing water bodies. So I mean, it's just to, I mean, caution all of us not to celebrate early, but to be cautious, possibly to prepare for a possible wave in case an outbreak may happen because of the oncoming rain season.
Okay. I want to move to interventions, but before then, and just perhaps you would elucidate a bit on this one, because you did touch on the factors, but also is the current climatic conditions and just also where we are as a country part of the reasons as to why we are seeing these cases, and if so, why?
Yeah, I would say yes, because of course we know globally we have climate change issues, which is mainly linked to global warming. That has caused now in Kenya, to be more specific, a prolonged drought situation than what we've seen in the previous decades. So if you are having a prolonged drought, then it means you're having water scarcity, because over time the water tables, we've seen in some countries, especially in arid and semi-arid counties, where they were having, you know, several rivers, but by now all these rivers are dry. So they only have a water point where they are lucky to get some partners or the ministry or the government supporting them to get water. But then you have the whole village and everyone in the neighborhood coming to the same water point. Humans are drinking, you know, they are also pastoralists, so they keep livestock, which also need to take water. So, I mean, with that kind of sharing for, I mean, a limited resource, chances of contamination are high. And then, of course, what we said about malnutrition, that, of course, climate change causing drought, and then you enter into a prolonged malnutrition situation. So most of the people could be walking out there in these regions that, I mean, their immune systems or their nutritional status is not up to optimal. So in case of any disease, not only limited to cholera, I mean, they are vulnerable to suffer disease. They may not have suffered because their immunity may have worked that one out.
Okay, I hear you. So then this just means that it's not just an issue of hygiene, sanitation, but there are various other factors as to why we are where we are as a country in regards to this cholera outbreak. But let's come to interventions, Kelly. The 2.2 million vaccines that were procured by the Ministry of Health. When you look at these 17 counties and the numbers, just as you've said, the numbers are continuing to increase. Is this enough? Is there more being done? What is happening?
Yeah, actually it's not enough. And as MSF, we are advocating for more vaccines. Of course, we understand that from the manufacturing standpoint, the stockpile is quite limited. And also therefore the countries in need, and if you narrow down to specific regions and communities, is quite a lot of need in terms of population numbers. So we continue to push for, I mean, the concerned stakeholders to ensure there is adequate manufacturing and supply of this oral cholera vaccine that could save, I mean, several health situations and also, of course, death due to cholera. Yeah, in the country, of course, the 2.2 million is not adequate. Actually, some of the counties have ended this vaccination drive yesterday because it was scheduled to go on for 10 days. They have actually achieved this target. But I mean, the way the vaccine was distributed was also prioritized per county. The ones that were having active cases and up to a particular threshold of this number of cases. And even in these counties, not everyone in the county received. We have 4 counties that were prioritized for this oral cholera vaccine.
Which ones are this?
Garissa is one of them, Nairobi, Wajir and Tana River. But also when you go down... These are counties with active cases? Yeah, but if you go down and then you realize that even not the whole county as such, there were sub-counties also which were affected because some sub-counties had not reported some cases. But I mean, that is the best way you could do with a limited resource. You have to prioritize. Yes. Yeah, so I mean, this lobby continues so that we see that we have better coverage of cholera vaccine in the whole country. Yeah, I mean, if we have to reduce on these numbers, now seeing that you're saying that this is preventable, then the vaccines might just be what we could be needing as a country, much as we would look into other issues and areas, but also that could be quite important. But again, also one would ask, even as you talk about these vaccines, is it for all populations, the young, old? How is it working? Yeah, cholera vaccine is recommended for anyone who is 1 year and above. Okay. Yeah. Is there enough sensitization being done as far as this vaccine rollout and uptake is concerned? There is some sensitization that has been ongoing since the first case was reported on, I think, 8th of October. Yeah, and I mean, Ministry of Health and other partners continue to sensitize. Yeah, I think it's an ongoing course because you may not say it's that adequate because also the way sensitization is structured, they are paging it on resource availability. So you want to start or intensify this sensitization in the regions that are currently affected, but then you slowly or continuously open it up to all other regions. But in general, as a health education message, yeah, we pass it to everyone on the prevention measures for cholera, that please always clean your hands with soap and water. Eat properly cooked food. Yeah. And also, of course, if there is provision for vaccine, then please request for it. Yeah. And also, this is largely what you're equally doing as MSF, more of advocacy and sensitization on the same. Yeah. How has the reception been like in the areas that you've been in conjunction with MOH? Are they listening to what you're saying as far as hygiene is concerned, prevention measures, washing of the hands, cooking, eating properly cooked food, take the vaccine? Are they taking it in terms of whatever message you're putting to them? Yeah, actually I would say reception of these preventive messages in places where we've worked in collaboration with MOH has been good. And we applaud the community for this because we've managed to engage, to pass the necessary message. Have open forums, where they ask questions for clarifications. And yeah, we can see the positive impact of this intervention. Although it's not adequate, yeah, but you can see some gains made out of this community engagement. All right, I hear you. What questions might Kenyans be having, since you said that you equally open forums for Q&A, asking questions for clarifications, wanting to know more, get more instant knowledge? What is this biggest questions that Kenyans are having as far as cholera is concerned? Yeah. From what you can remember, just being in the field. No, what we've seen, they understand, of course, after these sessions have happened, and all the sensitizers that we have posters rolled out by Ministry of Health. They are having what we call a focus group discussion before vaccines roll out. We saw this, and in where public health restrictions have been recommended, either in market places or areas of congregation, we have seen communities improve their preventive measures.
Okay. So then how long does this vaccine stay in one's body? Because it's good enough to say of the preventive measures, especially as far as sanitation, hygiene is concerned. But here we are just trying to look at better ways to deal with the issues of drought and movement from one place to another, one county to another. But then so for this vaccine, which is what we are currently focusing on, how long does it stay in one's body to protect them?
Of course, research is ongoing, but for now, the current vaccines that we are using, which is Shancol and Uvicol, which the country has brought in, they give you, one dose gives you immunity for at least 3 months. If you are lucky to get 2 doses, then you'd be able to be protected for 2 to 3 years. So for now, because of this global shortage, of course, the country has made provision for, populations to only receive 1 dose. We should protect them for at least 3 months to possibly 6. And the focus is that at least with 1 dose, we should be able to, halt the current outbreak.
Now I understand why employing all the other various intervention methods is really very important, because 3 to 6 months is good, but not good enough. And just as you've alluded to, due to the global shortage, everyone almost wanting these vaccines. But also, Kelly, what are these symptoms that one should be looking at? Because you talked about Nairobi as well. Counties such as Kiambu, just within, the city center, I should say. What symptoms should one be looking at in these areas?
So just before symptoms, also to reiterate on these preventive measures, and it's true, as you put it, that is not only the vaccine. It has its place in terms of prevention measures, and it's going to reduce the number of new cases for cholera. But for sure, we need to continue with the basic, water and sanitation preventive measures that we can do at an individual level. Boiling water, for example, if you have to, this is drinking water, and of course chlorinating it if you are not able to boil, and always try to eat well cooked food. And if they are fruits, you also make sure they are cleaned with clean water. All right. So then, just quickly about the symptoms. As you conclude. So symptoms for cholera. The symptom number 1, it's watery, profuse diarrhea, which is quite classical for cholera. And sometimes it's effortless, you don't feel like you need to pass stools. It may just come. In addition to this, there is vomiting, which is also quite common with most of the people infected with cholera. And then, of course, there are other now general symptoms like fatigue. You may have a headache or not. And what we see when these patients or whoever is infected with cholera comes before you, you realize that they are dehydrated. You'll see either if they are children, they have, sunken eyes. There's what we call skin tagger. When you stretch their skin, it goes down slowly. And some of them actually would be feeling very thirsty. So that you'd realize either they are requesting for water. If he's a child or if he's an adult, he's going to take drinkable water quite frequent.
So these are some of those signs and symptoms that one should be very key on. Fatigue, headache, vomiting, dehydration, sunken eyes, especially for children. there should be like a telltale signs.
Yeah,
if you see, especially, you know, all of them, are, especially at once, should tell you something is not correct.
It's amiss.
Something is amiss.
But I would want to, share to the public the most common one would be diarrhea. That should give you a sign. And this diarrhea usually is watery and profuse. We have some cases, of course, with diarrhea which is not watery, profuse. Those are isolated cases, but usually you'll have diarrhea and then vomiting. Or nausea.
These are the key ones. Diarrhea, profuse ones, and vomiting. Okay. I think this is a good place to end this conversation. Good place to end this conversation. Thank you so much, Kelly, for your time, for your valuable inputs, helping us understand where we are as a country, and just also what we can do as a society, as a people, you and I, much as we want to wait for the government to procure more vaccines, but what we can do in our own small way to at least assist you and I, you know, just assist Kenyans as far as this cholera outbreak is concerned. Thank you so much for your time.
Thank you. And also just to make possibly a last call, of course, other than lobbying for this vaccine deployment, I think it is also important that partners increase also this humanitarian and medical support because of these other factors that we see, malnutrition response, water and sanitation. Because if we focus on vaccine alone and nobody is offering water and sanitation solution, we need more pit latrines in this region. We need safe drinking water in this region. And then finally, for MSF, also for well-wishers who may wish to make donations, we have a website, www.msf.org. So if you go to this website, you'll be able to find directions on how to offer donations.
Thank you. That is Kelly Khabala, the Deputy Medical Coordinator, MSF. Definitely what has formed center of our conversation. And this last hour of the program is just looking at where we are as a country as far as the cholera outbreak is concerned. Good place to end this conversation.